continue to, of course, update you with information with respect to the pandemic and how we are managing the COVID-19 pandemic here in St. Kitts and Nevis. The pandemic is still with us. It is not over. Although there is good news that there is a vaccine. In fact, there are two of them. You have the Pfizer vaccine, BioNTech, and we also have the Moderna vaccine. But nonetheless, we are still required to adhere to the protocols that have been put in place, all these measures of the social and physical distancing, the wearing of masks, and the sanitization of hands and spaces and places, which is so important. Thank you, as always, for joining us for today's briefing, and thank you for the part that you are playing in ensuring that all of us, both citizens and residents here in St. Kitts and Nevis, that we are kept safe from the COVID-19 virus and its transmission. Of course, whenever we see the hustle and bustle around town and around the country, we know that Christmas is around the corner. But the pandemic is still with us. I would like to invite first Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all. Just over a week ago, we launched our new events permission management system. Since its launch, we have received almost 100 applications for permission to host events. These events range from small backyard family gatherings with just over 25 persons to large outdoor parties with over 100 persons. This gives an indication of the number of social activities that we can anticipate over the upcoming holiday period. As we try to balance the need for entertainment and the need to protect public health, we ask for your cooperation and your partnership in keeping our Federation safe during this health pandemic. We remind you that each application will be given careful evaluation and the appropriate decision made with regards to whether or not permission is granted. We must recognize that this year things are not business as usual, and as such, we must all be prepared to adjust our habits. At this time of year, we experience heightened criminal activity in the Federation, particularly crimes against property. The theft of cell phones, televisions, and other electronic devices from homes and unattended vehicles are commonplace, but they are preventable if you follow simple, basic personal security guidelines, such as not leaving valuables exposed in parked vehicles, not leaving your doors and windows open, especially when you are not around, installing cameras and alarm systems on your homes, and keeping your property lighted at night, even if you are not there, or especially when you are not there. In closing, I want, on behalf of the Commissioner of Police and the rank of file of the Royal St. Christopher Nevis Police Force, to wish each of you a very Merry Christmas and a safe and COVID-free carnival period. We remind you to avoid large crowds, crowded places, and always wear a face mask when you're in public, and maintain a physical distance of 6 feet from persons around you. And where possible, practice good hand hygiene and other sanitization behavior. Thank you.
We are experiencing some technical problems, and we will take a short break, and we will be right back. Was his presentation okay? Staying with us and bearing with us. We continue our briefing. I now invite the Chief Medical Officer, Dr. Hazel Laws, to present us with the Health Emergency Operations Center COVID-19 report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone who is tuned in. As per usual, it's my task to share with you the Health Emergency Operating Center's situation report for today, December 23rd, 2020. What's the situation in terms of COVID-19 in the Federation? To date, the Federation would have reported a total of 30 confirmed cases of COVID-19, 20 of whom were reported in St. Kitts and 10 in Nevis. At present, we only have 4 active cases, and so 26 of the cases would have recovered nicely. Based on the World Health Organization's COVID-19 dashboard, 76.4 million confirmed cases have been reported internationally. 1.7 million deaths have been reported internationally. 24% of the confirmed cases were reported by the United States of America. So more specifically, 18.5 million confirmed cases have been reported in the United States of America, and 19% of the total deaths globally have been reported by the USA. In the Caribbean region, 329,328 confirmed cases have been reported, and the death toll stands at 5,525. And this is at December, as of December 17th. In St. Kitts and Nevis, our health team continue testing individuals who return from the hotspots and all individuals who come, all inbound passengers. So to date, 4,824 persons have been tested with only 30 positives. That's a positivity rate of 0.7%. At present, we only have 4 active cases, and so only 4 persons are in isolation. We have 3,054 persons who would have been released from quarantine, and that is between February of this year to present. The total number of persons in quarantine facilities amounts to 342. Number of cases recovered, 26. Okay, I would like to inform the general population that the NextGen lab will be closed on the following public holidays, and that is Friday, December 25th. NextGen lab will be closed. Also, the lab will be closed next Friday, January the 1st, New Year's Day. We want to inform you that the lab will be open on the following public holidays, more specifically Saturday, December 26, 2020. So yes, the lab will be processing samples on Saturday, December 26. A number of persons who are presently vacationing in place and in quarantine at the various COVID-19 sites, they have been inquiring. And so yes, the lab will be working on Saturday. Samples will be processed. However, please note that there is going to be an additional cost to having your samples be processed on the public holidays. So a cost of approximately 50% will be added to the existing standard rate for processing samples on the public holidays. Recently, we've been bombarded in the news regarding the Moderna vaccine. So this is the second COVID-19 vaccine candidate that is being rolled out. So the Food and Drug Administration in the United States of America would have authorized emergency use of the Moderna's vaccine. And so this is being rolled out as we speak. Now, emergency use authorization allows the manufacturers and the health facilities in the US to use this vaccine that has not yet ascertained full approval. It allows an experimental vaccine to be used if there is evidence that its potential benefits outweigh the risks, while more data is being collected. So in other words, all those individuals who would have received either the Pfizer-BioNTech vaccine in the United Kingdom or the US, and along with the Moderna vaccine, they have to log onto their phones and send information to the CDC on a daily basis. They have to provide information regarding their health status having received the vaccine. And so live data is being collected on these 2 vaccine candidates as time elapses. Moderna's vaccine has an efficacy rate of about 94%. Okay, so are there any differences between the Pfizer-BioNTech vaccine and Moderna's vaccine? They are similar in terms of their mechanism of action. However, there are some differences based on the data that we would have received from the trials or the vaccine trials. And so one difference, Moderna produced more evidence that its vaccine can prevent severe disease. And so, ladies and gentlemen, these 2 vaccines, we are assured that once you receive them, it prevents you getting moderate to severe COVID-19 disease, and it prevents death or mortality. And so one difference is that Moderna's vaccine provides stronger evidence that it prevents severe disease versus the Pfizer-BioNTech counterpart. A second difference is that the Pfizer-BioNTech vaccine starts to protect you. In other words, immunity, the individuals who would receive the Pfizer vaccine, they start mounting an immune response within 10 days of the first dose. However, based on the data from Moderna's trial, this may not be the case. All right, so these are the two potential differences between these two vaccines. How long will immunity last once you would have received either of these two vaccines? Well, that question is still open. All right, so the scientists are not sure in terms of the duration for which an individual can be protected having received these vaccines. Another puzzle is whether the vaccine can prevent persons from spreading the disease. And so to date, there are some data gaps. So we do not know if the vaccine prevents you from contracting COVID-19, and we are not sure if either of the vaccine prevents you from spreading the virus to another person. However, we are assured or reassured that the vaccines prevent you from severe disease and even death. New data from Moderna suggests that its vaccine may reduce transmission. And so, ladies and gentlemen, over the next 3 to 4 or 5 months, as they continue collecting live data from individuals who would have received these vaccines, we are hopeful, or the scientists are hopeful, that the data gap will be filled. Okay, so what are some of the side effects being experienced having received either of these vaccines? So the side effects include fever, fatigue or malaise, headache, and there have been reports from both of the trials regarding individuals who would have received these vaccines and they would have developed a temporary paralysis of the facial nerve, which is sometimes called Bell's palsy. Now, the scientists, they are not sure if the vaccines would have caused this, or is it that it may have been a coincidence, because it's not unusual for one to develop Bell's palsy having experienced viral infection. And so the FDA is tracking the occurrence of Bell's palsy as the vaccines are rolled out. It is expected that the COVID-19 vaccines will become available to Caribbean member states like ours by the second quarter of 2021. So we are hopeful that by about April, May, June of 2021, that we would be able to offer the vaccines here in St. Kitts and Nevis. COVAX, it's a global facility which we have signed on to, and all member states have signed on to COVAX, and it's a mechanism by which the Federation and other member states can access vaccine candidates as they become available. So COVAX announces additional deals to access promising COVID-19 vaccine candidates. Now, COVAX now has agreements in place to access nearly 2 billion doses of several promising vaccine candidates. And so all of the COVAX participating countries will be able to access doses to protect the vulnerable groups in our populations within the first half of 2021. So that's the reassurance coming out of the COVAX facility. Okay, so what's happening in the United Kingdom? So Just a few days ago, we got word that there is a new variant of the SARS-CoV-2 virus, or the virus that causes COVID-19. It's a virus under investigation 2020-12//01. That's the name of the new variant. It was identified in the United Kingdom, and so preliminary reports tell us that this variant may be, they're not absolutely sure as yet, more transmissible, with an estimated increased transmissibility of between 40 to 70%. And so the scientists are still evaluating this new variant of the SARS-CoV-2 virus. Initial analysis suggests there is no change in the severity of the illness or mortality rate. So in other words, at present, the thinking is that the clinical outcomes are not really poorer with this new variant, and there isn't an associated increase in mortality associated with this new variant, and no specific population groups have been affected. And so that's good news, really, in terms of the information that they have gleaned regarding this new variant. And so on that note, our cabinet made a decision just over an hour ago, whereby the British Airways flights between the United Kingdom and the Federation will be suspended from Saturday, December 26th to Saturday, January 2nd, 2021. So in other words, the BA flights to and fro the Federation will be suspended over the next 2 weeks until the Ministry of Health will continue evaluating the situation as it unfolds in the United Kingdom regarding this newly identified variant of the SARS-CoV-2 virus. Because of this new variant making its way across the United Kingdom, they are on yet another lockdown in the United Kingdom, a Tier 4 lockdown where individuals are asked to remain at home. Cases of this new variant have been detected outside of the United Kingdom. So a few cases have already been detected in Denmark, in the Netherlands, in Belgium, and in Australia, all as a result of travel. Please note, the world is very small. It's like a village, and because of globalization, these microscopic organisms travel real fast. There is currently no evidence that the mutations in the spike protein will affect vaccine efficacy. This situation will be closely monitored as the vaccines are rolled out. So in other words, it's a bit early to say if the occurrence of this new variant will affect the efficacy of either of the two vaccine candidates that are being utilized and rolled out across the United Kingdom, Canada, United States of America. Ladies and gentlemen, based on the foregoing, it's very, very important for us, even in this season, to be vigilant and adhere to the COVID-19 prevention measures. More and more persons are wearing their face mask, and we are particularly pleased about that. And we want individuals, as we go into Christmas Eve, even this evening with the market hours, where you can go down to the market and get your naturally grown stuff, please wear your face mask tomorrow as you do your last-minute shopping. Please make sure you have your face mask and your hand sanitizer. So you have to make sure you wear your face mask while in public places. When you are amongst a crowd of individuals, make sure you maintain good hand hygiene and maintain that physical distance of 3 to 6 feet between yourselves and others to reduce the risk of exposure to the virus. Ladies and gentlemen, recently, a tile made its round on social media. St. Kitts and Nevis has the lowest rate of confirmed COVID-19 cases in the Caribbean. The Federation has the lowest COVID-19 risk in the hemisphere. Ladies and gentlemen, this is an achievement. And at this time of year, when you want to interact with friends and loved ones, we can move around in St. Kitts and Nevis without too much of a fear with respect to being exposed to the virus. And this is, it's a good place to be in. And most importantly, I'm thinking that we need to be really happy and thankful for this reality. And I also want to say that there is hope also at this time, because the scientists, they have given us vaccines. We now have 2 vaccine candidates being rolled out, and a number of at least 2 or 3 others that will be rolled out in short order. And so there is light at the end of the pandemic tunnel, and so there is hope. So even at this time of Christmas in St. Kitts and Nevis, there is something to be thankful for in terms of the low risk of exposure to the virus, and there is hope in terms of the vaccine candidates that are on the scene. And so, you know, next 2021, our situation can improve given this reality. So we are thankful that we can come to the end of 2020, and it's a rather pleasant note. Ladies and gentlemen, at this time, I want to extend Merry Christmas and a Happy New Year to everyone. And I extend these greetings on behalf of the Ministry of Health and the Health Emergency Operating Committee. May the Christmas season bring warmth, happiness, and well-being into your life. May you ring in 2021 with love and laughter. Thank you.
Thank you very much, Dr. Laws. You know that red, of course, which we're wearing, is a famous Christmas color. We now invite the chair of the COVID-19 National Task Force, Mr. Abdia Samuel, to give us his presentation.
Thank you, Mr. Williams, and good afternoon, all. Today, for this National Emergency Operations Center's briefing, I want to highlight a number of things to the general public. One such is the quarantine. I have been asked about quarantine, affordable quarantine, and I just want to inform the general public that Ocean's Edge has been approved as a quarantine site with a flat baseline cost of $800 for the 14 days of quarantine. These are self-sustainable apartments, which includes the various amenities such as cable, internet, televisions. You have a stove, fridge, and a very comfortable environment for you to be in. I'm also understanding that it has washing machines and dryers that you can use to do your laundry. Equally so, we also should be adding shortly Koi Resort, and the Koi Resort should come on board shortly to provide quarantine services. Again, we are still in the negotiation phase of this, but my understanding is we are looking at ranges from $60 a night to approximately $90 a night, which should make it affordable for our nationals and residents alike to return to the Federation. Last time we were here, we notified you of the birthing, or safe harboring rather, of the Rhapsody of the Seas. And on the 11th of December, the Grandee of the Seas came alongside the Port Zante at approximately 7:50 a.m. with 72 crew members on board. And I want to assure you, the general public, that the 22 points of terms and agreement in which this was facilitated are being adhered to, are being carried out, and I want to urge all stakeholders involved in this process to continue to adhere to such. This is in the best interest of the safety and security of our citizens. Now, one of the things I want to notify you of is that there will be crew changes. What does that mean? That all the necessary protocols that are applied to inbound travelers will be applied to those persons on the ship who may need to leave the ship to return to their homes, and those who are leaving their homes to return to the ship. And this is done in a very controlled measure. So therefore, when you see this, this is not that they're just coming off the ship haphazardly and interacting with our citizens. As I have said to you over and over, this is done through the corridor of containment. So right now, we have approximately 150 crew members docked between the two ships at the Port Zante Pier. There has been an increase in airlift into the Federation of St. Kitts and Nevis. And the increase in airlift, we would see that as of the 19th of December, there will be scheduled flights on Wednesdays, Saturdays, and Sundays. And Saturdays, we will have an increase in the number of flights per day. There will be one AA flight out of Miami, and there will also be an AA flight out of Charlotte. With the increase of these flights, it means that we have to increase our attention, our awareness, as per our surroundings. Also, there will be an increase in the risk to the country for the importation of cases. However, as Dr. Lars has mentioned, we have been doing exceptionally well. We will also see that Liat will also be increasing their flights. They will be having 2 flights on Saturdays, weekly flights on Saturdays, one out of Barbados and one out of Antigua. The COVID-19 task force would have met on Tuesday, that would have been on Tuesday the 22nd, and the general membership of the team would have advised me as the chair to make the necessary recommendations to the Federal Cabinet of Ministers with reference to the travel advisory on the present situation as outlined by Dr. Laws in the United Kingdom. The recommendations have been adhered to, as Dr. Laws already mentioned. So we want to thank the Cabinet for their leadership and providing the necessary support to safeguard the Federation of St. Kitts and Nevis. And this was done by studying the actions taken by over 30 countries around the world to mitigate against the spread of this new variant. I want to continue by making an appeal during this festive time to all, in particular, entertainers and party goers. This time of year is a festive time, and if you're going to be festive, please do so in moderation. Complying with the protocols is one such way in which we can do so. Remember, this is in the interest of all of us. The successes that we have gained in managing the COVID-19 pandemics thus far should not be celebrated with complacency. Even though we are seeing a drastic change in persons being more compliant, more can be done. So I want to urge you to continue to improve in the adherence of the protocols. Again, let us continue to fight as the finish line can be seen in the horizon. I want to take this opportunity to commend a number of businesses who would have done extremely well during the reduced VAT days or discounted VAT days, the 18th and 19th of December. I want to thank them for adhering to the call of enforcing the protocols and ensuring that they keep the employees safe, they keep the customers safe, and also the reputation of the establishment. Equally so, I want to highlight the good work that is being done by Customs and Excise along with CASPA in managing persons who need to go to the port and clear their goods that have been imported. I think the plan that was instituted by them has been working very well. But we must thank the people in particular for their cooperation and support thus far. So to you, the general public, and all these institutions, I say a job well done. Please note that today will be our final briefing for 2020. Approximately 11 to 12 months ago, we started with this epidemic being a challenge in Wuhan City, China, China, and then we saw how quickly it spread to the Caribbean region. To everyone who has been supporting and everyone who has also been providing the critique, constructive criticism, which is part and parcel of everything, I say thank you to you, to the medical professionals, to the security forces, to those working at our borders, the security at our borders, CASPA, NASPA, and to everyone who has contributed for the entire year. I want to say thank you to you, just how I thank the National COVID-19 Task Force yesterday as we had our last meeting and yesterday. So thank you to the general public in St. Kitts and Nevis for helping us to achieve the status that Dr. Laws would have said we have achieved as being one of the lowest risk countries in this hemisphere. So I take this opportunity to say to you a very Merry Christmas and a prosperous and lovely 2021 when it comes. Please permit me to also reach out to my Latino community by saying to them, les deseo una feliz Navidad y yo espero que cuando entre el año nuevo, entre un año nuevo con mucho amor y que tengan un buen año nuevo. Así que feliz Navidades para todos en la comunidad latina y que Dios me lo bendiga.
Thank you very much, Mr. Samuel, for your presentation. It brings us to the question and answer segment, but guess what? The one question that we had from SKN Newsline has been answered, and that is how thorough the presenters are, and they come prepared, anticipating what kind of questions would be asked. And the question had to do with the BA flight coming into St. Kitts and Nevis and how much that would have posed a risk, perhaps, to the Federation. And that question has been answered. I do have an announcement. There are many people who are inquiring if the Monday after Boxing Day is a holiday. It is not. So that's the first thing that I would state. We have received, many calls, and even from the business community, asking this question. This year, Christmas Day falls on a Friday, and Boxing Day, the day after, is on a Saturday. Also, New Year's Day falls on a Friday, and the day after, January 2nd, is on a Saturday. However, holidays are only given on the Monday when they fall, public holidays, when they fall on the Sunday. So if Boxing Day had fallen on a Sunday, then you will get the Monday as the holiday. And all of that is governed by the Public Holidays Act, Chapter 23.23. And I want to read for you from it in the schedule. It says that the anniversary of the birth of the sovereign of the day, of which due public notice shall be given, appointed to be kept as the sovereign's birthday, the first day of January in each year. Independence Day being the 19th day of September. National Heroes Day, which shall be the 16th day of September. If any of the above-mentioned days fall on a Sunday, the next following Monday shall be a public holiday. Boxing Day, that is the day after Christmas Day, but if Christmas Day falls on a Saturday, then the next following day, Monday, shall be a public holiday. And if Christmas Day falls on a Sunday, then the next following Monday and Tuesday shall be public holidays. Easter Monday, Labor Day, which is the first Monday in May, Whit Monday, the first Monday in August, which shall be known as Emancipation Day. These are public holidays. Sundays, Christmas Day, and Good Friday are observed as common law holidays. Additionally, the 2nd of January, which is also a public holiday, and which has been a public holiday, because it is a special public holiday, then the Act says that there has to be power to appoint the special public holiday, and the power it has been given to the Governor General, who issues a proclamation. He issues a proclamation that the 2nd of January is a public holiday. The Governor General has to issue that proclamation because it is a special public holiday. And I will read from the Act, the Public Holidays Act, on section 5A, chapter 23.23, which says, "It shall be lawful for the Governor General to issue a proclamation appointing a special day or part of a day to be reserved as a public holiday, either throughout the state or in any island, town, district, or village thereof, and any day or part of a day so appointed shall be kept as a close holiday in all banks, shops, stores, and public offices aforesaid in the state or in such island, town, district, or village thereof, and shall, as regards bills of exchange and promissory notes, be deemed to be a public holiday for all purposes of the Act." So the Governor General will issue a proclamation for the holiday on January 2nd. As of the Monday following Boxing Day, it is not a public holiday. It is not a public holiday. And so I just wanted to clarify that with the benefit of the Public Holidays Act so that people will know that public holidays, only when they fall on a Sunday, that the Monday is really declared the holiday. And in this case, that is not so. I want to thank all of you for joining us for today's NEOC COVID-19 weekly briefing. As the chair of the COVID-19 National Task Force mentioned, this is our final briefing for 2020. And thank you so much for your attention and your patronage throughout 2020. We have been here a very long time, actually, for the most of the year. We have been here since, I think it's February, because then the press conferences and so on in the Ministry of Health started before we even had our first 2 cases. And it has been a long time, but nonetheless, we want to thank all the dedicated people to this cause. First, of course, you, the general public, who has been dedicated and who has, for the most part, obeyed the measures and protocols that have been put in place for our own safety and our own security. And to thank the media, of course, for playing its part, ZIZ, AJ, and Khalid, and all of the others who have been here to make sure that this COVID-19 briefing is carried live, not only on television, it's carried live on radio, and it's also transmitted on social media. I want to thank, of course, Mrs. Christmas Jacob, who has played a vital part in terms of providing sign language. We are indeed not just local, we are international, because when you see a lot of these press conferences, whether they're the Prime Minister's press conferences, in some of these developed countries and so on, we see the benefit of sign language. And she has done that for us, and indeed we are very proud. I do want to thank all the very hard-working people on the front lines, the airport, those who are now having to work in the hotels, and so on, the compliance task force, the data entry clerks, those persons who are receiving the information, processing it, and so on, in terms of the tests and sending back responses in terms of who is eligible to come and who is not. All of these people are to be thanked. We continue to thank the entire COVID-19 National Task Force, but of course the familiar faces that we see, they are not the entire task force, but they are the persons who come here and present. So Superintendent Cromwell Henry, who has presented us with the law and made us quite educated in terms of what is expected of us with respect to the law. Our Chief Medical Officer, Dr. Hazel Laws, we thank you very much for your dedication to this cause. To Dr. Cameron Wilkinson, who has been there from the very beginning and who continues to be there with his support and to answer all the questions that the people have and so on. His contribution has been invaluable. And Mr. Abdia Samuel, the chair of the COVID-19 National Task Force, who has held it together and who continues to be very dedicated to this cause. He's also dedicated to telling us about the weather. He's also the National Disaster Coordinator. And so we thank everybody for the part, the role that they have played. And we want to really say season's greetings and all the best for the new year from all of us here at the National Emergency Operations Center. The chair of the COVID-19 National Task Force and the chair of the NEOC, Mr. Abdia Samuel, has asked me to convey those greetings. Thank you very much. We will be back. We will see you next year. Until then, I am Les Roy Williams. Continue to take care.